Good afternoon, and thank you so much for having us today. I'm so happy to be here, and thank you, Dr. Joseph, for inviting us. Today I'm going to talk a little bit about mindfulness and meditation and how these techniques can be used to help manage your life a little better, to help manage the fear, to help manage the uncertainty you may have. This presentation is not about your cancer, it's about you as a complete individual. So let's get started. What is mindfulness? Has anyone ever heard the term mindfulness before? Has anyone practiced meditation? Great. So simply put, mindfulness is the state of being actively and openly present in the here and now. It's non-judgmental, it's accepting, and it's intentional. Mindfulness is about embracing your emotions and your thoughts by acknowledging them and being present to them and being present to the experience of them in the moment. So how often are you thinking and you notice that you're thinking about the past, something that happened years ago, or you're thinking about the future? So much of our time is spent in either the past or the future, and what mindfulness does is it puts us in the present moment. When we practice mindfulness, we cultivate the ability to be present to all situations, no matter how difficult that might be. And through the practice of mindfulness, we're able to think more clearly, make better decisions, and manage stress more elegantly, and to be more present to those we love. I love this quote, and I'm happy to share it with you. And this is something that I know for sure. As long as you are breathing, there is more right with you than wrong, no matter how ill or hopeless you may feel. And this is a standard tenet of mindfulness. The practice is based on this. There is always more right with you than wrong. So by practicing mindfulness, we begin to tame the wandering mind, that part of the mind that is always somewhere else, that is not living in the present. And we notice a story without becoming the story. Our stories may be, I have cancer, or our stories may be that I have too much to deal with, or how am I going to do this? But when we live in the present moment, we access the part of ourselves that helps us be more resourceful, that helps us better advocate for ourselves. We can be more present when interacting with our physicians. So how many of you have had this experience where you're in the doctor's office, you're talking to your physician, he's telling you important information, you leave the office, and you have no idea what he said? This happens frequently. And so by practicing some simple techniques, which I'll go through in a minute, you can get yourself into a present state while you're at your doctor's office, or while you're having a treatment, or while someone's conveying important information to you. So you can be there, so you can listen, so you can hear, so you can ask the right questions, and so you can advocate for yourself correctly. When we practice mindfulness, we begin to better manage our fear and our pain. And pain is an interesting thing because there are many levels to pain. Pain can be a sensation of tightness, pain can be a burning, pain can be a piercing, pain can be so many different things. But when we just say to ourselves, I'm in pain, well, that can mean anything. And as we begin to be more present to our experience, to notice the pain, to notice the differences in pain, we're able to better communicate that to our doctors. We're able to react better. Some pain requires an immediate reaction. Some pain doesn't. But some pain has a whole story to it. And so what mindfulness does is help you distinguish between the different levels of this and deal with it in a more elegant way. So just to give you a little science and credibility, mindfulness is clinically tested. It's used in hospitals around the world. It's evidence-based, it's cost-effective, and it's low-tech, and it's a great model for participatory healthcare. So I want this to be interactive, so we're going to practice some techniques that you can take with you after today and use in your everyday life. You can use with your family, you can use dealing with the stress of your life, and of course you can use with your physician. So a common or an important part of mindfulness is this concept of just one breath. When we focus on the breath, we're immediately placed in the present moment. And this is something that I do all the time, and I'm sure you do it too. Do you ever feel the need to just stop if you're stressed out, or stop if you're upset, and just take a breath, just take a deep breath, just let it pass? Well, this is a mindfulness practice. So I'm going to invite you right now to just take a breath with me. Just gently close your eyes if you wish, or gaze downward, and let's just take a deep breath. And as you breathe, notice, just begin to focus on the breath and begin to focus where it is in your body. And it may be in your chest or your belly, or you may feel it beneath the nostrils. And just notice the in-breath and the space, and then the out-breath, and how perfect it is and how automatic it is. And as you do this, you may start to notice some thoughts come in. You may be thinking about something you have to do later today, or something in the past, or something in the future. And these are distractions, and your mind will do this, and this is normal. But as this happens, just return to the breath as many times as you need to. You know, our thoughts are like a train going through a station. And just because the train is passing the station doesn't mean you need to get on the train. You could just be quiet with your breath and just gently return every time you have a thought, every time you have an idea, just return to the breath. And you could do this anywhere, in a treatment room, on the subway, in the waiting room, with your family. It's just taking a moment for yourself, a moment to be clear, and a moment just for you. So you could gently open your eyes now. And as you do this and as you practice this, you'll find that this becomes an automatic practice. And you can begin to remove some of the clutter from your mind, some of the chatter, and begin to make clearer decisions, and begin to be more present for yourself while you're dealing with your treatment, while you're dealing with your disease, with the fear that you may have, the uncertainty. But a great side effect of this is that you also begin to fully experience the pleasure of life and the joy that you have, the joy of your family, the little moments. When you're more present to your experience, it's not only are you more present to the bad things, but you're more present to the good things. I'll quickly go through one other exercise today, and this is very helpful, and it's especially helpful if you're sitting in the doctor's office and not hearing a word he's saying or she's saying, or if you're just in a stressful situation, and it's called breathing hands. And so I invite you to just take one of your hand and put it on your, I'm going to just step over here, I'll speak loudly, and just put it on your thigh. And then with the other hand, take your index finger and just gently begin to trace your finger on your thigh. And as you go up, say breathing in to yourself and breathe in. And as you go down, say breathing out. And just gently trace breathing in, breathing out, and again, breathing in, breathing out, and again, breathing in, breathing out, breathing in, breathing out, and then retrace back the other way. And this is something that can be done at any time. And it's something that immediately puts you in the present moment. And it's also something that can be done while someone's talking to you. They don't need to know you're doing it. You don't need to close your eyes. You can be present for both yourself and for them. And I invite you to just try these things, to have an open mind, and to utilize it when you're in a stressful situation, or even when you're in a calm situation. The next exercise, which I'll just tell you about, but we won't go through, is called the body scan. And the body scan is also something you can do at any time. And it's really just noticing the sensations of your body. We usually start with the feet. And just noticing the feet, and then the knees, and the thighs, just going up your body, just going to each body part, and just noticing any sensations you may feel, or no sensation. And when we do this, we don't visualize the body part, we just kind of try to identify the sensation without any story, without any image, but just a noticing practice. Mindfulness is really about noticing your current situation. And this practice is particularly useful for managing pain and discomfort because we begin to notice, as we practice it, different sensations in our body, different textures to pain, different levels of pain. And we do that without story, without worry. We're just noticing. We're just noticing it. And this, of course, helps you manage pain. It helps you communicate to your physician your level of pain. And it's really a practice to get to know your body better. So I'm just going to leave you with some resources. There's a great book specifically for people dealing with cancer, and it's called Mindfulness-Based Cancer Recovery, a step-by-step MBSR approach to help you cope with treatment and reclaim your life. And what it does is it integrates several practices, many of which I spoke of today, into your everyday life to help you deal with your recovery. It's available on Amazon. If you guys use an iPhone or an Android phone and you enjoy using apps, I'd like to recommend 2 apps for you. One is called Headspace, and the other is Insight Timer. And these are both free apps that will help you develop a mindfulness and meditation practice. They're easy to use, they're fun, and I just invite you to try them. Also on YouTube, there are tons of meditations of all different types that are freely available. So I suggest you go check that out as well if you're interested. And finally, I just invite you to find a place to practice mindfulness and meditation. And I do it along with my colleagues at Mindful Harlem. It's a mindfulness center in Harlem on 119th Street and Frederick Douglass. We're open to everyone. Everyone is welcome. And you can learn more about that at mindfulharlem.org. And just, I know the first book I recommended is about MBSR. We also offer MBSR classes. And all our programs are available to everyone, regardless of ability to pay. We just make it work for you. So, finally, I invite you to check out our website at mindfulharlem.org. And I've left my email address there. And everyone or anyone is welcome to contact me if you have any questions. So thank you very much for your time today. I hope you will practice some of the things we spoke about, and have a wonderful day.